Hi, good evening, everyone. Good evening. Hi, this is Christine Crowell here, and welcome, all of you to the 5-week challenge. And I'm really excited to talk to you today about some of the really important things, because what I want you to think about is not just what we used to do in our staffing business, our medical staffing business. It's about what we are doing now. Where are we going in the future with this? Let me just make sure that my team can see me, because I am live now on YouTube. So just let everyone know that I'm here. Just bear with me. Because we are live. Make sure everyone can hear me fine. So as I said, we are live on YouTube, and I just want to make sure my team are here as well. Okay, so someone's just said they can hear me. So I'll carry on with what I was saying before I got interrupted there. So I really want us to think about where we want to go in our healthcare business, in our medical staffing business. Now, what type of agency do you really want? Is it something that really resonates with you, or do you want to look at something that is, i.e. the future, because this is what today is also about. So I want you to think about the type of medical staffing agency that you're going to be. Now, last week I talked about your business planning, your business plan template. You was provided with a business plan along with a business plan spreadsheet. Now, my team emailed that to you as well. I can also drop a comment. I can actually drop it here in the chat so that you can see. So maybe a member of my team can put that in the chat as well. But I really want you to think about where you're going with your medical staffing agency, because you want to be ahead of the general Joe Blogs type of agency. So where are you really going to be with your agency? Where do you see your agency in 5 years' time, for example? Because, or even 10 years' time, because the future is now. Basically, this is happening now, and if we don't embrace it, we'll get left behind. So you want to look at what the future is, and you want to become part of that future growth as well. So on my team, are you able to put it in the YouTube chat? Give me some hearts here. So I really want you to think about where you are. So when I asked you last week to do your business plan, what business plan did you do? What products and services did you say that you wanted to offer? Have you thought about that? Because we've got to really look at some of the future things as well. It's not just about providing nurses and healthcare assistants. There's a lot more to medical staffing or healthcare in itself. It's not just nurses and healthcare assistants, for example. So what is it that you've chosen to do in your healthcare staffing business, for example? And I'll go into some of that today. And I just want you to be aware of this. So welcome all of you, and thank you for being here as well and listening to the training today. I know some of you are watching the replay. If you're watching the replay, hashtag replay. If you're watching the live, click live as well. Okay, so I just wanted you to be aware of that. So first of all, what you want to do in order to capitalize the new developments in healthcare, you want to really pay particular attention to the content of providing medical staffing. As you, as a medical staffing healthcare provider, what is it that you're going to provide? What is it do you want to do? So really look at utilizing what is the advancement that is currently happening in recruitment technology right now that you can start implementing. So medical staffing providers, if you look at AI, and I know it sounds, some of you don't agree with it, but AI platforms, we can't avoid it. It's happening. Okay. All we can do is be a part of it and look at what it is that we can do that's going to make us stand out. It's going to really make us up our game at the end of the day. So what recruitment processes are you going to put into your healthcare business, into your medical staffing business? Because that is important as well, for you to think about what type of AI platforms that can be used currently at the moment. So there's technologies that can help you to source, to screen, and to match candidates more effortlessly, okay? As well as managing large volumes of applications with greater accuracy. Now, yes, when you begin, you're the one-man band and you think, oh my goodness, I've got to pay for all of these things. But you got to look at what things that you can get right now that's going to make it easier for you to then grow your business without frustration, without delays, without, trying to figure things out when you're actually in the thick of running your business. You really want to get to grips with it now. What type of software are you going to be using that's going to help you in your healthcare business, for example, medical staffing business? I'm going to be dropping a link here as well after the training regarding the new software, one of the most brilliant software, which is used by a client who is also a good friend of mine, for example, in the States, and they do medical staffing, and they're doing extremely well in their medical staffing business. And she created the software like 12 years ago, for example, for her medical staffing business, because she was for a staffing business, because she was frustrated with what was currently out there. And she knew what she wanted to have for her medical staffing business, for example. Now, we're also offering that same software to you as well. For you, it's in a beta mode at the moment, but it really is good. It's absolutely amazing. And I think you should try it out. Let me know if you want me to arrange for you to have a demo. It is not costing you anything because it's in beta. What have you got to lose? You got nothing to lose, right? So give it a try. It will help you. But like I said, again, you've got to look at what recruitment technologies that you're going to need to run your successful medical healthcare staffing business, for example. So where are you now in your medical staffing business, for example? So as providers, you've got to really look at what AI-driven tools, platforms that you can use that's going to help you in your recruitment process, because that will minimize risk. It will also help the team members be onboarded a lot quicker. It will help them to get out a lot faster. You will also be checking to see if they're compliant. You'll also see what shifts that are available. They'll be able to see them as well. You'll also be able to do timesheets. You'll also be able to do invoicing. The list is endless. You'll also be able to see whereabouts they are, the location whilst they're out working, so that you can track your team to make sure that they're safe, and A, and B, that they're going to be on time. And if they're running late, then you know how far they are away from a particular location for whoever it is that they're going to deliver the service to that you've asked them to go. So that's the reason why you need to look at, one of the reasons why you need to look at the advanced AI driven technology. Another one is telehealth. Health is here. We can't avoid it. And if you're able to show competence, because there is a rise in telehealth, staffing providers like yourselves should focus on this training and recruiting healthcare professionals who are skilled in delivering these services via digital platforms, i.e., GPs, for example, nurses. Who are they? Who is it that can do this, that is qualified and competent to do so? Okay. So then you need to look at how you can use this, how you can use the telehealth platform software, for example, and you're able to manage remote patients, interactions, and adhering to online consultation protocols. Now, you may not be doing a medical staffing business, for example. You may be just doing a staffing business, for example, and you need to really think about what type of software it is that you're going to be doing that's going to really help benefit you and your organization so that you can grow as big as possible. Because with software, with you having AI, with you having all of the latest technology, you'll be able to grow a lot faster. And I can vouch for it because we are testing something currently right now that we're going to be implementing in June so that we can ensure that things are being done according to how we want it done as an organization, i.e., that's making sure that staff members are reporting properly, that the work is being done, and that there's a flow, and that you can, that the system will be able to see what's happening and alert if anything isn't happening as it should be. So why not think of implementing, or just at least having a look to see what it is? You can then look at becoming specialized training. You can offer specialized training programs for medical treatment technologies. You can also look at how you can meet this specialist need. And that's like, for example, robotic surgery, genetic counseling, personalized medicine. Staffing agencies can capitalize on this trend by offering specialized training programs or certifications to the staff members that will be delivering this care. It makes you more attractive to healthcare facilities, and you'll be able to expand. Isn't that something that you'd like to do? Is to just look at this, to be different and not be the same. I will upload the business plan and the template as well. So when we look at being flexible, that is one of the things that you've got to look at, being flexible as an organization, providing that staffing solution. So what developments in healthcare demand, which is able for you to be able to offer flexible staffing solutions. You as a provider can offer part-time, locum, or you can do contract roles, permanent placement that cater to the changing needs of the healthcare facility, such as seasonal fluctuations in patients' load. And there's also project-based work like health screening and all different types of different healthcare services that you can provide. Do you really understand what I'm saying to you? Because I'm really excited because I am seeing this happen so much in the States. I'm seeing it happen here in the UK as well. Now imagine you becoming a specialized staffing agency where you're providing permanent placement. Imagine, for example, if you was to look at a robotic surgeon, the hourly rate for that is very high, but also the annual rate is very high as well. So imagine you're getting 20%. Well, actually, you would charge more than 20%. You would charge something like 30% because it is a specialized field. I want you to do your research. I want you to check out what the specialized staff that you can provide on a permanent basis as well as on a temporary basis. So imagine that you placed a robotic surgeon and they're going to pay, say, 150, 200,000 a year, for example. Imagine you getting 30% of that. And I'm going to get my calculator out because you'll get to see if you're doing 200,000 times 0.30, that's 60,000. 60,000 with one placement. That's a one-off payment of 60,000. Now, who works for the whole year for that? Who here works for the whole year for that? For 60,000. Some of you work for half of that, for example. So imagine you as the medical or staffing provider, and you're providing staff members and you're getting a rate of 60,000 to keep without paying wages. This is a permanent placement that I'm referring to, not a temporary placement. Imagine if you did one a month. That's 60,000 a month. Do you get where I'm coming from? Because I'm really excited for you. But imagine if you're doing the hourly rate, and I think it's about $300 an hour, right? So then you're getting, say, 0.65. So you're getting 195 an hour. So if that person's doing a 8-hour shift, that's 1,560 that you are getting a day for one robotic surgeon. Never mind, they're getting their pay, of course, but you, after they've been placed and they've done the work, then you're then getting 1,560 after their wages, after you've paid them. Then obviously you've got other things that you're thinking about, expenses that you have to pay. But look at that. So I want you all to be thinking smarter. We're all in 2024. It's been a game changer because of lives that have been lost, because of COVID, because of how we realize that we want to work from home. But with this, because I've been there, I've been running agencies, 30 years ago, 1.5 million, for example, a year in the 2.5 years. Yeah. In my 2.5 year. So the turnover was $1.5 million. So you imagine what needed to be done in order to earn that amount of money. It was a lot of hours. It was a lot of work. It was a lot of stress. It was a lot of stress for the staff because they were having to go out and cover calls at very short notice. But imagine if you did one place, we've got to look at things in a smarter way. And like I said, 2024 has really brought it home to me. Imagine if you was to place one surgeon a month, one surgeon a month, permanent placement could bring you in $60,000, for example, a month. When you're placing lots of staff members, the work is 10 times harder than placing one specialized person. And imagine you're doing that month after month after month. You've only got to find 12 people a year, for example, right? 12 times 60,000 is 720,000 a year that you can earn. Isn't that a lot better? Where you're not having to pay out for that surgeon's wages, for example. So like if you was placing temporary, I mean, temporary is good, don't get me wrong, but it's a lot of work. It works on volume. But imagine if you placed one surgeon a day would then bring in for you 1,500 a day after you've paid their wages. That's a good one as well. It is. So let's think about working smarter, because then that way we've got more freedom, more time freedom. Who wants more time freedom? Put your hands up now if you want more time freedom, more work-life balance. Because by the time you've placed 2,000 staff members, for example, that's a lot of hard work, isn't it? Whereas 12 a year and you've produced 720,000 and you get to keep 80, 90% of that. Isn't that better? I know what I'd choose. If I was to start all over again, I would do that. I would look at the highest specialist need, what the need is currently at the moment, right now, for example. But the need is, I would be looking at the specialist need, which is the AI, the robotic, the telehealth. I would really be looking at that. So that is one of them. Now, remember there's the business plan, and I'll be uploading that here. You should have had this email to you. Let me know if you haven't had this email to you, because you should have had that email to you so that you can actually do the work as well. Like I said, this is a 5-week challenge. You're meant to be doing the work. But I want to show you things that are easy, not hard. I mean, we've got a boot camp. It starts tomorrow, which is our contracts boot camp. But I want to show you how to do things the easy way, because you don't need any specialist training to be able to do medical healthcare staffing, for example. You got to just place the people. You got to have a website. You got to be registered, obviously. Your company has to be registered, for example. But think about what specialist training that you want to provide. And another one is looking at, like I said, there's robotic surgery, there's genetic counseling. You could be counseling companies by having specialist staff that can do the work or even provide them permanently with that organization. So become personalized. Another thing that you can be doing is by offering flexible staffing solutions. With the demand on healthcare, you want to be more flexible. You can provide, like I said, part-time, you can provide permanent placement, you can look at what flexibility can you provide. Maybe you'll provide temporary workers until they're used to that temporary worker, and then you place them permanently for a fee. A lot of the new things that's coming out now is wellness and support programs. You could be offering that as well. I'll just drink my water. So you want to look at how you can attract and retain your staff members, top talent. You want to make sure that you, as the provider, should focus on their well-being. The employee's well-being is just as important as the service user or the patient's well-being. So you implementing a support and wellness program, it will make you stand out. It will also help improve job satisfaction, and it will reduce burnout. It will help you to increase your healthcare staff. And if you could do like a data of your staff's absenteeism, for example, and then by the end of the year, you can see by offering the wellness program compared to the previous year, that you notice that there was an increase in retention and that there was an increase in staff showing up for work or contractors, because you may have self-employed people, contractors, as well as your staff members as well. But by implementing these wellness and support programs, it will make you stand out in the crowd. And also the organization that you're looking to contract with, they'll think, oh, I like the sound of that. You look after your staff members. That means your staff are going to look after my client, for example. Maybe you could even offer that to the organization as well, because they need it as well. And sometimes as care managers, sometimes they don't have that time. So maybe you could offer that to organizations that you want to work with. You could do that as a free gift as part of the training and them using you to provide staff. So you can also use the software. For example, like I said, you can create a wellness and support program. Now, I've started doing this for 2024. I'm helping other care providers and coaches, for example, to build their own programs, their own training programs. Why not you? If you're specialized in anything that you feel that you'll be able to train other people, then why not do that? Why not look at partnering with educational institutions? By you forming a partnership with nursing schools and other educational institutions, staffing agencies can ensure a steady pipeline of qualified candidates. These partnerships can be facilitated on an ongoing basis at the education and the training center. For you could be looking for existing staff, but also keep in mind new developments that are happening. So have an open day at your college, your local college. Say, hey, look, we're looking at hiring staff members, for example. So go to the colleges that are doing like specialist technology, healthcare technology. Go there and look at recruiting staff. Software is really, really big. If you can provide software staff, IT staff in the healthcare field, that is also a no-brainer for the medical staffing industry. Being specialized is going to make you stand out. And I really want you to think about that, because there's so many new things out there that you're possibly not aware of that you can be providing, whereas the margin is a lot higher than just providing a nurse or a healthcare worker. And I don't mean that in a derogatory way by me saying by just providing. I want you to work smarter. That is my goal for 2024. It's my passion and it's my goal that you're not working so hard that you don't get to see your family because you're out working all the time. I've been there, I've done it, worn the t-shirt. I want you to be able to work smarter, not harder. We're not meant to work harder. We're meant to work smarter, as long as the work gets done, but do it in a smarter way. You can get to where you want to be a lot quicker by these solutions that I'm talking to you about. Because when I made 1.5 million, for example, in my home care agency many years ago, for example, it took a lot of work. I had like hundreds of staff members. I had about 20 staff members in the office, manning the staff that were in the field. And then we were taking on more work, and the rate per hour. And now I'm not saying not to do this because it is good. You need to build, if your business is working on that model at the moment, great, wonderful. Stick with it because it will get bigger and bigger. But my point is to you is to look at this model as well, with a view to you making this your priority, where you become more specialized and you then stand out in the crowd from the average Joe blog agency, for example. You want to be able to then create room and space to expand to a higher level, because whatever takes you to the 1 million level, or whatever takes you to the 200,000 level, is not going to take you to the 1 million level. You're going to need a new set of skills, a new set of staff members to be able to manage that team, for example. But you also need to know what's involved so that you can run your ship effectively. If the worst thing was to happen, you're still there to run your business and you know how things are run, and then you can hire staff when you need to, for example. But I want you all to think about the work smarter, not harder rule. But it all has to begin from within. What is it that you want? What do you truly want in your life? What do you want? Do you want to be working hard? No, you don't. You want to work smarter, right? So think about the business plan. What is it that you're going to implement? And I'm just going to see if I can upload the business plan here so that you can see. What if it lets me attach anything? It just says engage. No, I can't upload it. Let's have a look here. No, I'll have to see if I can add that later. So think about what type of medical staffing that you're going to do. Okay. What is it that you're going to provide that's going to make you different? You don't want to be the same. You want to be different. You don't want to be like the agency down the road. What is it that you're doing? Talk to your community, collaborate, find out what the need is. But I'm giving you some real golden nuggets here. If you want to be different, then find out who's doing this already. Where are they? This is all part of your business planning as well. So are they currently doing this already in the marketplace? Yes, they are. But are they doing it as a medical staffing business, for example? What they're currently offering right now. I want you to think about, as a medical staffing provider, how best can you serve those healthcare facilities? And that's by you working in collaboration and offering specialized staff members to them. The opportunity for growth will present itself. And you also want to look at the quality of the care provided, because the healthcare facility, they're equipped with workforce that can adapt to and thrive rapidly in a changing healthcare environment. But you can also join forces with them by collaborating with them. I'd like to hear from you which one that really resonates with you, because like I said, if I was to do this all over again, I may do a video on this. I would start off with these models. I would look at the healthcare technology. I would look at what is out there at the moment, who's currently offering this. Look online, see who's currently offering what it is that I've just spoken about today. And then see if there's a gap, because they may be offering it in a totally different location than you. And there's hospitals that need you because you're local. Or maybe you want to be national, where you're covering all of the areas. It's up to you. I would look at covering all of those areas. So think about, in your business plan, what type of service you're going to provide. Maybe this could be part of your year 2, 2025 goal, that you want to do healthcare technology. If that is the case, look at it now and plan for it now. Use so many hours, or possibly one day a week, where you're going to plan introducing healthcare technology into your organization, into your staffing agency. What else can you think about that you can provide from a healthcare provider or a medical staffing or a staffing organization? There's personnel, right? That's not necessarily nurses or healthcare workers, but they work in the hospitals as consultants. Maybe you can go along and see if you can offer that as well. So can you see where I'm coming from here? What else can you think about that you would like to offer? There's telemedicine, like I said. There's pharmaceutical and At the moment, they've got the robots in the hospitals, for example, and they're taking the medication from the pharmacy up to the wards, to the nurses' stations. There used to be someone, didn't they, that used to go and do that. Even porters, for example. Now they've got these robots that are doing the medication runs. They've got these robots doing a lot of things. And they're being introduced now. They say it's taking the nurses time where they can work on the ward rather than having to go to pharmacy, in the hospital pharmacy, for example, collect the medication. But usually it's not the nurse that does that anyway. Sometimes it is, but majority of the time it should be the pharmaceutical that deals with the medication in terms of delivering it to the hospital ward, because hospitals do have the pharmacy on site. But there is robots doing this now. So like I said, we've got to look at getting with the program. We've got to look at what we can offer as a staffing business. What can we offer as a medical staffing business? You can offer the staff that you can provide, whereby they are healthcare assistants and they're just sitting there watching monitors where these robots are actually in the patient's room. And it's happening today. I've seen it that many times when I was going to the States. For example, they're in the hospital. In the UK, they're starting. It's going to happen. So what can you do now to meet that need sooner rather than wait until everyone's starting to do it? Get in now. This is the time to do it now, because you can charge a higher fee for this. The government has spent or is spending trillions on this. So why don't you offer it as well? Whether you're offering a permanent placement or whether you're offering a temporary worker, why should you not do it? So your business plan, do let me know in the group who has done their business plan and whether you need any help. If you've got any questions here, you can ask me a question and I will answer it for you, because I want you to be a great success here. So what questions do you have? I'm just putting this into the chat. So what questions do you have? So I can answer them for you. Because who would like to do the technology side of things? Healthcare technology. The helping surgeons with providing surgeons who are trained in robotics. Who would like to offer that? Or maybe there's another service that you want to provide, because it's so important that we look at these things and look at getting ahead of the game, because it's here. We can't stop it. So what is it that we can do, for example, to provide our medical staff with organizations that are going to pay a higher rate, and you're providing a specialized staff member? Isn't it better to manage, say, 6 staff a month as opposed to 600 a month? What would you prefer to do? Because think about it, if you're providing 600 staff members and yet we've got to weigh the scales up here. It's the smarter working smarter rule, right? So if you're sending out 600 staff members a month, for example, sorry, not a month, a week, and you're placing one surgeon a month, and it's bringing in the same amount of money as you providing 600 staff members going out weekly on a temporary basis, what would the stress levels be? Would the stress levels be high, the same as if you're sending 600 staff out a week? No, it wouldn't. Your stress levels will be calm, but yet you'll be making more money, and you're working with the new technology now, and you're working with hospitals, specialized hospitals. What is it that you can do that's going to make you stand out? And I tell you what, if I had the chance to do it all over again, I certainly wouldn't be having 600 staff members that I'm sending out a week. I would rather send one person out a month to bring me in the same amount of money as sending out 600 staff. I hope you're hearing what I'm saying here, because this is a game changer. It's beautiful. And yes, you can still provide 600 staff members. But like I said, 2024 is about building the life that you want. It's about building a business around your lifestyle, not you working for that business and building your lifestyle around that business. It's got to come from you first. What do you want? How do you see your day? Do you see it where you're busy, you're stuck to your desk, 12-hour days, for example? How do you really see your time? Because your time is valuable. It really is. And you can work from home. But wouldn't it be lovely to place one person and get the same money as placing 600 staff members a week, for example? If you times that by 4 in a month, so you're looking at really 2,400 staff a month that you're sending out to work, whereas you're placing one permanent placement and you're getting the same amount of money. Something wrong there. Or you could look at another option. If you're going to want to do temporary workers, for example, then you send out your surgeon 12-hour days, for example, or 8 to 12 hours, because they must rest because of the work. And I know they're doing a lot of work these days. But imagine you're getting per day, you're getting 1,500 per day. You times that by 7, for example. This is after you've paid the wages, right? Just one staff member who's high level, times that by 7, that's 10,000 a week that you're getting after you've paid that staff member's wages. Then you're left with 10,500 a week to pay your bills, to pay yourself a wage. Why not do that? We all keep scrambling for the crumbs, whereas we can have the best if we think smarter and not work harder. So I hope that was helpful for you today. Part of your business planning, part of your medical staffing is what type of staff members are you going to place, because I want you to think about how many staff members that you want to work with. It all depends on the number of hours you've got in the day. You know, some of you have got family, friends, you just want to chill, you want to relax. Maybe you just want to do a couple of hours a day. And that couple of hours a day can produce you one person a month that you could get 60,000 for. Because the need is there. The need is strong. It's not a saturated market, it's a specialized market. So imagine if you was providing staff in that way, what you can get back from that and still have time to enjoy the rest of your day. You know, I always call it, you know, swallow the frog first type of thing. Do the hard work first. Then you can enjoy the rest of your day. So I hope that you've really picked up on that, because it's happening. We can't stop it. People are doing this right now. And they're doing extremely well with it, because there's hardly anyone doing it. So why don't you become that? Because this is a big world. When I say there's hardly anyone doing it, the big guys are doing it, the ones that are doing 8, 9 figures. How do you think they get to 8, 9 figures? They're doing multiple different things, of course, but this is one way as well that you can get to multiple 7 figures, high multiple 7 figures. It even tempted me at doing it at one point. I thought, maybe I should try this, because I do like to try things to make sure that they work. But I'm seeing that it's working, and I haven't even tried it. The healthcare technology, that is. So why should you not do that? It is amazing. Right, so we're coming up to 1 hour. We've got 6 more minutes. Does anyone have any questions? What questions do you have? Let me know. Give me some hearts. Let me know that you can hear me. What questions do you currently have? If not, you can always drop me a message as well. So my team will send you the video of this. This will be also uploaded in your training vault as well, in the 5-week challenge training vault. The videos are all there as well, so you can watch them on YouTube as well as in your own dashboard as well. So thank you so much, everyone. I don't think anyone's got any questions, so we will leave it at that. Thank you. Have a wonderful, blessed day, everyone. Take care. Thank you. Goodbye. Bye. Bye, everyone. Thank you, team. Bye.